Hello everybody. We're here to talk about limb length. Okay, so this is your first competencies. It's competency 1 and 2 material. So we're starting off with limb length. And we're going to talk about your lab handout. And the first body part that we're going to do for limb length and how to measure limb length will be the upper extremity. And then the next video will show you lower extremity. So the reason why we would want to take a measure of a limb is we are seeing if there's a discrepancy from one side to the other. Whatever the affected side is, we're comparing it to the patient's other unaffected extremity. So that's the use of how we compare if the limbs are equal in length and have symmetry, or if there are other issues that are complicating function. There are several reasons on your list here on the left side of your handout, and they're talking about, for example, post-fracture, or maybe there is back pain. The lumbar spine is affected by the pelvis, and the pelvis is tilted in some way, and their lower extremities are of unequal length. So that is a reason for an example of the lower extremity. For fractures in children, if they still have the epiphyseal plate that is growing their bone, there might be an indwelling stimulator that was placed that we want to see if the bone growth is happening at the rate it should, and again comparing to the other side to see if it's becoming more equal. Another use possibly is for an orthotic. If again we have lower extremity asymmetry, we would want to see if the equal weight bearing is happening, and that will also help with the posture that I mentioned before. So postural obliquities also have issues for the patient in terms of pain. So we always use something of this nature, which is your typical tape measure. Okay, it has two sides. Obviously, we have inches and we have centimeters. We use centimeters because it's more precise. However, if in clinic somebody has taken a measure and you're reassessing the measure and they've used the inch side, then you go ahead and do the same thing. If, for example, it's a child and we are going time after time and measuring and over a period of time, then you'll want to use the same landmarks and you'll want to use the same method. If the therapist before you used different landmarks, you will use exactly what's in the chart that they have written down, so that we're comparing to the same increments. Other than that, we're going to show you increments that are pretty much commonly used, and this way if you had to do it initially, you would use these landmarks. Sometimes on an eval the increments are not there and the measurement has not been done, and the PT may tell you to go ahead and do that initial measurement. In that case, you would do both sides so you have a comparison of left to right. Okay, so let's start with the upper extremity, the entire upper extremity. So in your handout, the entire upper extremity is done with, hi G, hi. This is my patient, my daughter, Gianna, and we're going to show you anatomical position. So I'm going to have her extend her hands out, and the landmarks are the anterior acromion process, the tip of it. Okay, so when you're palpating, make sure you're palpating correctly. This is where cues come in, and students may miss a measure because we do have to be within a certain, for example, 1 centimeter for the entire upper extremity. If I measure, or Dr. Coop measures after you, we have to be within that to be competent. So you want to be accurate. So for the acromion process, I'm palpating. Can you come closer? Matthew's my cameraman. Thank you, camera. I'm palpating and I can feel it's going to be anterior. So right here is her anterior acromion. I basically can either palpate from the, as you will do in Knies, or would have done in Knies, from the clavicle and then we come out and you feel the acromion. I can feel the anterior and the posterior acromion and the lateral acromion here. You don't want to be on the humeral head, which is just distal to that, and that's a lot of people make those mistakes. And this way they're shorter in their landmarks and their measure. So the other alternative method is to feel that spinous process, or I'm sorry, the spine of the scapula. And as I come out laterally, I can hit that acromion and feel the tip. So again, it's going to be that anterior tip of the acromion, which is right here. And a lot of times we tell you to go ahead and mark it. So Gianna, do you mind if I mark it? I should have asked that.
No.
Okay, so if you mark it, we can come out and make sure your palpation's correct. So I've marked her acromion. Now I'm going to take my tape measure. You can stay there. And I'm going to put the 0 point right on the marking. So I don't use the tab. The 0 starts here, so that would be, you know, a couple, 2.5 centimeters or so if I added that in. But my 0 point has to be right on my marking, and then I have to make sure my entire extremity is nice and extended. I'm going to her distal tip of her third finger, and we don't round up. So just to see the tissue, don't include the nail. Okay, it's going to be 70, getting a good close up. Okay, 73, and that's a 0.5. I'm going to go out to 73.8. So that would be the exact measure of her entire extremity. Okay, so just to note, we have support here. So before you get started, you want to have the extremity supported adequately, because if I took these away, what happens to her shoulders, it goes into extension. Okay, so we want a neutral position, anatomical position, and everything extended to get an accurate measure. Okay, all right, so that's the entire upper extremity. So remembering those landmarks are key. Okay, G, I'm just going to support your arm again. So we're going to do the next measure, which would be the upper arm. Okay, and in your handout, your landmarks are listed here. So we did the entire upper extremity. Now it's the upper arm, and this one we must be within 0.5 centimeters. So if I were, or Dr. Coop were to take that measure after you, and we're within that 0.5, then we're good. Okay, so in the fundamental position, okay, so I'm just going to place her in that fundamental position, which looks like this. So thumb up, pointing to the ceiling. I'm going to palpate now the lateral acromion. So we know that this was her anterior acromion. Now if I come lateral, okay, it kind of looks like this. If I were to draw her acromion, remember it's kind of like a little rectangle. So this is her lateral acromion, and it's going to the distal point, landmark, would be right here at her lateral epicondyle. So I made the 2 markings. Again, it's not typically what we do in clinic, but while you're practicing, it's helpful so that we can see if your landmarks are correct and come behind you and check on those. So I'm going to place my 0 mark and go to her next marking, just under 34. So we want to be precise. I'm going to say it's 33.8 for her upper arm. So 33.8 is what I would write down. Again, these are going in your SOAP notes. Where is the SOAP note section that all of the assessments and measures are going to go would be your objective section, so don't forget that. All right, so the next one is forearm. So again, we're in fundamental position, so I'm going to leave her just like this. She's well supported, okay? And my landmarks are going to be the olecranon. Okay, so of course it's underneath and it's really hard to get. So a lot of times what we like to do is say, okay, we're going to flex a little bit, just relax, G, and I'm going to palpate it in flexion, and it's the proximal tip. It's the proximal tip. So if I leave my finger here and extend, okay, I could then mark my olecranon, and I could bring the marking up laterally a little bit so that I can see it. The other method is if I wanted to feel soft tissue, soft tissue, soft tissue. I feel her triceps and I come right into that bony prominence. I could feel the olecranon and just move it up just a little bit so that I can see it better when I use my measuring tape. Okay, the other landmark is the ulnar styloid process. So I'm just kind of pronating her so you can see if I palpate that distal ulna, where the ulnar styloid process is. Remember, it's the distal tip of it. So you're gonna feel, what I do is I typically wanna feel the bone till it ends into that joint space and just mark the very tip of it. So I kind of backed up to feel that bone, okay? So there is my, let me see it, okay? There's my tube. All right, I know it's done in fundamental, so I'm gonna put her arm back, and now I'm gonna use my tape and put my 0, okay? All the way to my ulnar styloid, distal tip here. And we're gonna say it's 27.3. Okay, that is my measure. Perfect. Thanks, G. Okay, the last one we're gonna do is the hand. Now I have Gianna supine here. The alternative method is to have her in sitting, but if your patient has any joint instability, especially at the shoulder, causing a patient to distract that joint a little bit and open up that space would be gravity. So if she was sitting in gravity and there wasn't a lot of good stabilizing forces with ligaments and muscle and tendon not holding that humerus in the capsule, it will drop down slightly, okay? So we might see a little bit of a step towards that humeral head, and we don't want distraction happening on the joint, so we prefer our patient lying down if we can. If the patient couldn't breathe or some other pathology was prohibiting this position, we have the alternative as sitting. Okay, the last one, and I would do this in sitting, is the hand, but since she's here, I'm gonna have her just stay here, and I can do it in supine as well. So I'm gonna just take the support out so that she is resting her hand. But we want her hand to be in neutral position. We don't want any deviations, whether ulnar or radial. So nice neutral position. And we're gonna use that ulnar styloid process again, okay? And this is a 0.5 centimeter difference as well. So here's my ulnar styloid process. I come across the dorsum of the hand, and I'm going to use the distal tip of the third digit. I'm not gonna take into account the nail, and it's going to be 16 on the dot. Okay, so her hand length would be 16. And that is all of the upper extremity. We'll get back with the lowers. Thank you.